Bismillahirrahmanirrahim. Short message to stop coronavirus transmission. My name is Dr. Mamdouh Al-Bahnasawi, Professor of Tropical Medicine, Military Medical Academy, Consultant of Tropical, Endemic and Infectious Diseases, Past Post, Manager of Al-Maza Military Fever Hospital, Manager of Military Institute of Health and Epidemiology, Chairman of Vaxera Holding Company, Head of Central Laboratory of the Ministry of Health. In spite of great effort was taken to stop corona transmission, no good results until now. So we must add another weapon. Is corona mutated quickly? This is my hypothesis. The virus has the capability to change into another strain by antigenic drift or shift to overcome our immunity when being inside our body. What is the clue? If it is genetically engineering, I think it is highly unstable virus. Cytokine, a second step, cytokine storm. This may be due to changing the antigenic characters after being mutated, leading to overproduction of other new antibodies, and so useless production of useless new antibodies with resultant exhaustion of our immunity. Taking a sample from patients, almost always searching for coronavirus. What is the possibility of viral mutation? Is it applicable or need another probe? Do we have or take post-mortem sample to test for this possibility beside the pathological examination? Do we protect our healthcare workers, our soldiers who fight this virus? The researcher documented that increasing concentration inside the cell protective against the virus invasion. What makes the thing to be entered inside the cell and increased concentration is ionophore. Chloroquine is used as ionophore to take the virus from outside into the inside of the cell, making this possibility happen. So no virus entry. What about if the virus enter? Chloroquine is a basic drug. Also raise the pH of the vacuoles and the lysosome, making them metabolically inert or inactive. So there is no RP polymerase production, so there is no translation of the virus, and at the end no viral replication. Also, chloroquine bind with cyanic acid receptor on the cell surface, making not to fuse to the cell surface to be enter the cell again. So multi-arms. Chloroquine is an ancient drug used to treat malaria. It's very effective until there is some area become resistant to malaria and others are sensitive. So this virus, this chloroquine as antiviral documented was very good during taking the malaria as a treatment and as a prophylaxis. In my mind, there is no viral epidemics during this period happened to the African countries, except for recently there is no using of chloroquine, but using another drugs to fight for malaria. Chloroquine is a good drug, tolerant. I think it is side effects tolerant. No grave side effect except cardiovascular, and this is not for all people. In my experience and my treatment of such patients, there is no grave side effects happen. How to take this drug? It also take as a prophylaxis to endemic area once per week before departure from your area, and during the period you stay in this endemic area, and 4 weeks after returning once per week to abolish this malaria infection. So why we don't give our doctors and the healthcare worker to fight this virus. Two reasons. First of all, protect them from being infected. They are our weapon to fight this virus. Second, not to be a source to transmit the virus from them to the community. Because every now and then people come and go seeking for medical advice inside the hospital. Side effects: headache, dizziness, abdominal pain, vomiting, diarrhea, pruritus, rash, hyperpigmentation, hair loss. Not all people. Cardiac, prolonged QT interval, and maybe bundled branch block cardiomyopathy. FDA approved that chloroquine, hydroxychloroquine can be given on inpatient basis. If there is grave side effects, so can be managed in the hospital. Conclusion: giving our healthcare worker prophylaxis of chloroquine, because half-life of chloroquine is 3 to 5 days, maybe 1 week, maybe more than that, making this the lysosome alkalinity, no viral replication inside the cell, and it can be stable, not be infected, and not transmit its infection to another person. So I advise to give this healthcare worker prophylaxis of chloroquine once per week to protect them against the corona, especially if they are present in the hospital. Disinfect inside and outside the hospital every day. 3. By this we will save our doctor, nurses, other healthcare worker, especially if they are approved to be taken on inpatient basis. What researchers that can we do in such time? Taking sample from highly infected area and also around fever hospital, from air, ground, and water. Taking sample from infected person in the hospital to detect any mutation every 3 days, and keep in mind that the probe used to detect corona may be not applicable for such a mutation. Post-mortem sample can be cultured to see if there is mutation or not in a biosafety level 3 in at least inexperienced person. Thank you.